Good morning. My name is Kohut, and I am the Community Liaison for Cathedral Village. Cathedral Village is just a lovely life care community located in Upper Roxborough, and we provide all levels of care. Currently, they're doing such a wonderful renovation on the outside. Everything is perfect before, but we are surrounded by trees, and that's unusual for the city of Philadelphia. So it just looks so beautiful, and the residents are wonderful. They just enjoy so much living in a life care community, but also so local to everything else. They go into Philadelphia for plays and theater and shopping, so it's just a real nice community to be in. So I wanted to just talk about injury prevention. And what we're talking about, injury prevention, it really is basically falling. And that's what we have to find out more about. People are living longer, and things happen. 1 out of 4 adults 65 and over fall, but less than 1/2 do not tell their doctor. Now that is significant. They're hiding it, they just feel that I don't want to share because nothing happened to me, I'm okay, so they don't share. Falls cause broken bones, most particularly in the wrist, ankle, and hip fracture. And that is because, especially in the wrist, if you're going down, you might just go down and try to prevent the fall, and your wrist is fractured. 3 million older adults treated in the emergency room. 36 million falls are reported, and this is nationally. Leading cause of death, injury, it is injury related. So falls is really a very important part of our lives, especially as we age. 1 out of 5 falls are serious. Falling once doubles your chance of falling again. And again, that's significant. So we could all think, oh well, I did trip, but I protected myself. But statistics show that perhaps that one trip is what's going to, that you could have another fall after that. 800 seniors are hospitalized, with 95% having a hip fracture. Again, these numbers are very significant, and that is why I share them with you. 8 million people fell each year. In Pennsylvania, 28% are reported. 8 million people nationally fell. 28% are reported. And I would say Pennsylvania is probably in the middle of all of the states. Falls in 2012, leading cause of injury, 41% per 100,000 people. Today, 78% per 100,000 people in the year of 2022. So, statistics are always based on the year, and 2022, 78% per 100,000 people. So it has almost doubled or more than that over the years. So that is my introduction to why injury or fall prevention is absolutely so significant. And this is my name, Jeraldine Kohut. I am the Community Liaison for Cathedral Village. And I did reference the Academy of Geriatric Physical Therapy Association, American Occupational Therapy Association, and Mayo Clinic, because this program is so significant for everyone, but most specifically for older adults. And I wanted to get as much information as I can and as up to date as I could manage. Injury prevention. Falls are one of the leading causes of injury or death among older adults. Emergency room statistics demonstrate older adults will seek ER visits as a result of a fall. A fall can result in bruises, fractures, and head trauma. Even if injury isn't grave, trepidation or the fear about a future fall can impact an older adult's activities, and quality of life can suffer. So you've had that trip and fall, and you don't know why you fell. It just happened. Then all of a sudden you realize that I'm afraid, I'm fearful, And then you almost try to isolate yourself because that fall triggered something in your head. Most common myths about falls and the older adult. Falls happen to other people, not me. Falling is normal. That happens as we get older. Flexibility can always be regained. Taking medication doesn't increase risk of falling. And that is certainly something that we will talk about because medication can increase the risk of falling. I don't need to get my vision checked annually. I can see perfectly. And I have old glasses and I see perfectly. Are falls preventable? Yes. Falls are largely preventable. And that, again, is what we are going to learn a little bit more today. We're going to learn about the definition of a fall, fear of falling, risk factors for falling, vertigo, and action steps to reduce your fall risk. What is a fall? Well, you think, well, it's just, I'm going to trip, I'm going to be down on the ground. Landing on the ground or some other lower surface when you did not intend to be there. That's it. That's a fall. It includes slips and trips. A lot of people think, well, I remember the other day, I was sort of gathering all of my groceries from my car into the house, and I kind of tripped. That is considered a fall. You didn't go down, but you tripped. So what we're trying to say is anything really that happens that is not normal for you, you should consider as a fall, because that makes you trigger, what I should be looking for. So now, have you had a fall in the past year? If you fell, were you hurt? Do you worry about falling? Do you feel unsteady when standing or walking? Things that you should be thinking about, because if you've had a fall, probably this is worrisome to you, and you wonder, am I going to fall again? Because of that, do you limit activities? Fear of falling is a lasting concern that may cause a person to stop doing activities that he or she really loved to do. So when you have that fear, you've got to do something about it, because older adults cannot limit activities, and also socialization. That is what it's all about, to stay active and able to do certain things that you've always done or like to do. What does fear of falling matter? Why does fear of falling matter? It may stop you from activities, which I mentioned. Then also your legs weaken with inactivity. You could think, well, you're in your house or apartment and you're doing things pretty well, but you're just not as involved as you used to be. Inactivity can lead to falls. So if you're sitting all day watching television, and there is nothing wrong with watching television, but if that's what you're doing, your balance is affected because you normally are just sitting. You might get up for water or for your meals, but it's not good. May make the person feel alone. And I talked about socialization, which is so key, and it can lead to some depression. So fear of falling really matters for these things that I have already discussed. Types of fall risk factors. Most falls result from a number of risk factors, and they are physical risk factors, changes in your body that increases your risk for a fall. So it's physical, and your body is telling you that you might be dizzy, you might be different things, but it's a trigger. Behavioral risk factors, things we do or don't do that increases fall risk. Environmental risk factors, hazards in our home or community. So we're going to talk about those hazards in your home that you probably don't even think about because it's your home or apartment and you've always had it that way. Risk factors. You can change physical activity, home environment, your vision, medication use, social isolation, weakness, improper use of assistive devices, those canes or walkers. But what you can change is your age. Oh, wouldn't that be lovely? You can't change your gender. and also your ethnic background. So some of these things that you can't change, that's just part of you. What can you do to prevent falls? Exercise to improve balance and strength. I cannot emphasize that enough because it really does help. You must improve that balance and strength to prevent a fall. Have your doctor or pharmacist review your medicines. I think that's key, and we'll talk about that. Have your vision checked and make your home safer. All of these things are doable. All of these things should be done just to make sure that you're not going to have a fall. And we've already talked about the risk of falls and some of the dangers if you have fallen. Exercise recommendation. Talk to your doctor before starting any exercise program. So I always say that. No matter what program I'm talking about, I will always say, if you're going to do something that you haven't done before or that you haven't done in years, get your recommendation from your physician for that exercise program. You can begin with physical therapy or fall prevention classes. And if you talk to your doctor and you tell him, I'm really afraid, I did have a trip, and I'm afraid of falling, what can I do? He might suggest physical therapy, and they also have, through physical therapy, fall prevention classes. And I think that's so ideal and wonderful to do. But also be sure the class is age appropriate, because sometimes they can have all kinds of programs that they have for exercise, and you might walk in and you just think, I'm going to an exercise class, and it's a yoga class, and they really are people that do yoga, and they've done it all of their years. Well, you get on a mat, and all of a sudden you can't move your body like they are. So just make sure it is age and appropriate. Home safety evaluation. Identify and eliminate hazards in your home and community. An occupational therapist can help to identify safety issues and solutions. Because sometimes you say to yourself, well, my home is really safe. I'm able to clean it myself, I organize it. Well, as a nurse and in my career, I have done home evaluations. And for people that needed some support, we would go into an apartment or home, and the things that I would see, some people, I don't even know how they walk from their dining room or kitchen into the living room, because it's stacked with stuff. Papers piled up, magazines everywhere, beautiful, beautiful bric-a-brac everywhere. And sometimes, as we age, we must say to ourselves, is this all really necessary? I love my stuff. But sometimes you have to just realize you must really look at your safety first and organize your stuff. And even organizing it, pile up maybe some magazines and newspapers that you have already read, and just toss them, because you don't want anything extra in your house that you might be falling over or tripping. Medication and falls risk. Well, I will say this is so important. Side effects may make you dizzy. And when you get a new medication from your doctor, and you go to the pharmacy or Centerwell Pharmacy, however you get your medications, you get this little bottle in a little carton, and then you open it, and then there's a ream of papers that you open, one whole ream, and it's stuck in this little box, and the print has to be not legible. So you get your magnifying glass just to see what this medication is supposed to do. And a trick, if you can't read it or you don't have a magnifying glass, if you do have a computer, you can go online just to see, and you could print it out, and so just to see what that medication may cause. And one of the things, some medication does cause dizziness, and then you'll realize that, and you might want to talk to your doctor, because that is a fall risk. And if you've already fallen once, you don't want to fall twice. So you can do that, but some meds do make you dizzy, and a medication change may increase fall risk also. I can't say this enough. Use one pharmacy, be it a pharmacy near you or one of the, like Humana or Centerwell pharmacies. They're all available for questions and all of that, but use one. Because let's say you have one pharmacy that you use, and then you went to a different doctor and he was not really close by, but he ordered medication. So you go into that pharmacy, they will fill that medication, but they don't know the other medications that you're on. And oftentimes the pharmacy will ask that question, and sometimes since they don't know you, you're just going in there to fill a prescription. So always check that out. Also, review your medications annually with your primary care physician, another key thing to do. Because you might be taking medication that was ordered maybe 3 years ago, and that medication was for high blood pressure. And all of a sudden, because you're on medication for high blood pressure, perhaps that dose could be changed or something to look into. But review that medications annually with your primary or nurse practitioner. Before you can read and understand labels, be sure you can read and understand labels, and that is key also, because you might find something that you're reading that may not be good for you or may not be exactly what you thought the medication was going to be ordered for. So no problem, contact your doctor or nurse practitioner. You have to realize you are in control of what you're putting into your body. Medication compliance. Don't stop medication without talking to your doctor. A lot of people do. Know the names of all of your medications. List them for easy access. Ask about possible side effects. Find out if you need to avoid certain food or drink while taking the medication. Clean out your medicine cabinet every 3 to 6 months. All of these are really helpful for your compliance. And the one thing I would say is ask about the side effects, because you may not be aware of them or you couldn't really read them properly. But a lot of medications say to avoid certain food or drink while taking this medication. And I have read or helped people to understand, well, why can't I always have, the only thing that I ever do is have a little of those mini bags of potato chips. I love that so much, and I just limit myself to one bag. But guess what? That is sodium with all that salt on it. They are delicious, but perhaps one of the reasons that you're taking this medication, it could be a diuretic because you have too much sodium in your body. So always remember to chat with that doctor about, your medication. And cleaning out your cabinet every 3 to 6 months, that's a great idea, because you don't know what you can really accumulate or what you really need to keep, or those that have expired, they need to be taken care of. Vision and fall risk. First of all, get an annual eye exam. I think that is so important. Lots of people put that off, but surprisingly enough, when your eye specialist looks into those eyes, they can see so much more than you are imagining. You think, well, what are they doing? They're just going to see if I could see well. They're going to show me, that big B on the screen. All of a sudden, they shrink it, and you can't read anything. But that annual eye exam can see so much more. I have my husband we both go to the same ophthalmologist, and we both go the same time because she's in Philadelphia at Wills Eye Hospital, so we just conserve. We both go the same day and time, and we just sit. Well, she found something on my husband's eye that she did not like, and it was the first time she saw that. So she immediately told him that I really want you to go to a cardiologist, from an eye exam to a cardiologist. Well, he's okay, but that was really fearful. But that's why you're going to that ophthalmologist, and she's a great ophthalmologist. She saw something that triggered her to send my husband to a cardiologist, which he had not seen before because he had no issues. Multifocal lenses may blur or distort your vision looking down. And that is so true. If anyone has multifocal lenses, do you have those lenses? Well, it can, because they're on your eyes, glasses on your eyes. And that middle frame, right in the middle, that's when you're reading something. But if you look down or look up, you can become very blurred. And sometimes it really takes a while for you to get used to it. And once you do, they are wonderful, but you have to get used to it. Removing cataracts also may reduce fall risks. And that's something also that when you go to an ophthalmologist, they're going to say, yes, you do have a cataract, and yes, you should have it removed. Because it's that cloudy system, and you're not seeing as well as you should. And that could be a fall risk. Vertigo. So I think vertigo is so important. What is vertigo? Vertigo is a sensation when everything is moving even when you are standing perfectly still. People with vertigo feel dizzy as though they are swaying, turning, or spinning. That is, I have had vertigo one time, and it was, I would say, I can't even tell you how many years ago it was. And I remember vividly, I was in bed, and I was going to get up, and I was, going to the office, and all of a sudden, as I started to get up, I looked up at the ceiling, and I was spinning, literally spinning, when I looked up at the ceiling. I could not move. I could not get out of bed. And vertigo, it does happen. You can have loss of balance. You can be unbalanced. You can be pulled to one direction, feeling nauseated, vomiting, sweating, ringing in your ears. People talk about vertigo, they think, oh, it's just dizzy. Vertigo is a sensation that you cannot understand, and you certainly need treatment for it, and you can't just do it yourself. The causes of vertigo. This may be the result of an inner ear problem. BPPV, benign paroxysmal positional vertigo. Well, you may never have to do that, but it can be caused by calcium deposits in ear associated with age. Meniere syndrome, inner ear problem caused by buildup of fluid and changing pressure in the ear. Vestibular neuritis or neuritis, an inner ear problem related to infection, and it is usually viral. So you're thinking vertigo is one thing, and that is that constant spinning. You can't get out of bed. You are just so absolutely miserable. And these things are, some of the causes of that are what I'm just mentioning. Other issues include head or neck injury, brain problems such as a stroke or tumor, certain medications, and migraine headaches. So we don't take anything like dizziness. We'll start with dizziness, and then all of a sudden this dizziness becomes something that you cannot manage. You're lying in bed or sitting in a chair, and the room is spinning. So you must go to your doctor. Blood pressure and fall risk. Have regular blood pressure checks. It's absolutely significant. If you get dizzy when you stand up, see your doctor. Have the sit-to-stand blood pressure checked. So if you get dizzy when you stand up, you tell the doctor that, then that doctor or nurse practitioner is going to take your blood pressure both sitting and standing. Some blood pressure meds may increase fall risk. And again, talk to your doctor, especially if you have fallen before, and we talked about that. He really needs to know, what has happened. Chronic conditions may contribute to fall risk. So, I'm going to mention them. Diabetes, arthritis, stroke, multiple sclerosis, Parkinson's disease, chronic pain, depression, chronic lung disease, and then chronic obstructive pulmonary disease. So all of these things can contribute to a fall risk. And you think about them. Well, diabetes, perhaps you're taking insulin for that. Arthritis, your knees really are painful. Well, guess what? Are you going to want to walk around the block with painful knees? No. If you've had a stroke, multiple sclerosis, Parkinson's disease, you really shuffle when you're walking, and then with Parkinson's disease, you no longer can walk. Chronic pain, again, very significant for fall risk. Depression, someone who is depressed can just say, I'm not getting out of bed today. I don't feel well enough. I'm sad, I'm lonely, all of those things. Again, they contribute to a fall risk. Risk of falling may increase when you change your medication, illness or infection, pain, lack of sleep, being sad or depressed, move to new home or apartment. And I think that is so, so significant, because as these things come up, change in medication, we talked about that. If you have that infection, it could also increase your fall. Pain, lack of sleep is so significant. I do a program on sleep health, and the things that I discuss about that, people just say, well, I don't sleep as well as I used to, but I try to get at least 4 or 5 hours of sleep a night. That is not significant. You see all these advertisements on the television, and they're talking about if you have lack of sleep, and every medicine in the world can cure it. But this is what, you really don't want to just assume that lack of sleep is something that you just have as you get older. You have to identify and do some real questions about that. And moving to a new home or apartment, that is really significant. I know my husband and I, we've moved about 10 times. So every time we move, I'm thinking to myself, okay, now, where did I put that? Or, oh, I have to go up a flight of steps just to do that. Now I'm a little bit more oriented. We live in a 3-story house, and I try my very best to gather everything I can to get into the second level so I don't have to do the steps so many times. Start small. Choose one risk factor to address. Talk to your pharmacist and doctor review. That's wonderful. You want to start small, saying, are these medications that I take appropriate? You can go to the occupational therapist. They do home assessments. If you're over the age of 65, talk to your doctor and they will do these home assessments because they want to keep you safe. Scatter rugs are just not the most important, the good thing to have. And I have some examples of some of these things that I will share with you about scatter rugs and other things. The physical therapist help with balance, strength training, and safe moving. So if you have any concerns, or you have fallen, or you just tripped, talk to your doctor about these things because you can help yourself. Because some of the things that happen when you fall are certainly not the best. After falls occur, check for injury. Call for help if needed. Seek medical attention right away if you fall and hit your head. Call your doctor that you've fallen. They may suggest an ER visit. Check for safety hazards as a result of that fall, and learn how to get up safely. Now, all of these things are very, very important. But if you are on a blood thinner and you've fallen and you went back and you hit your head, but it wasn't really anything, absolutely call your doctor. Don't think it's just a nothing. And say, I fell. He knows you're calling your primary care physician. He knows you're on a blood thinner. He may have you just come in for a visit because you don't know what can happen. And it could happen within days after. So always when you fall, this is what you have to do. And learn how to get up safely. So that's really easy to say in print, but you could try it yourself. Put yourself down on the floor and pretend your knees hurt. Put an ace bandage around both knees and just to see how it feels. It's hard to get up from a fall. To reduce your risk of falling, you can consider changing your shoes. High heels, floppy slippers, shoes with slippery soles. All of these should go out. Do not walk in your stocking feet. That's what I should be sharing all of this stuff with you, but I can't wait till I get home and I kick off my shoes. Wear non-skid, sturdy shoes. Never stand on chairs or similar objects to get something you cannot reach. Immediately wipe spills off the floor. Stay active to maintain overall strength and know your limitations. So as we speak and as you are here listening to me, think of the things just that you should consider and say, I never thought of that. I never thought of scatter rugs. I never thought of the soles of my shoes and are they slippery? Can I fall with that? So you have to really consider what you can do before that fall. To make your home safer, remove boxes, newspapers, electrical cords from the walkway. Again, remember I said I used to do home health? You could not even walk through that front door because papers were piled everywhere, electrical cords everywhere. Move coffee tables and magazine racks from high traffic areas. Coffee tables are everybody wants a coffee table. You're watching television and you have Special Victims Unit. They're on Thursdays, I believe, and you really like that show, Mariska Hargitay, and all of a sudden you're putting your coffee cup right on that table, and and then all of a sudden you trip because you have to get a glass of water during the show. So coffee tables should be moved away or in a place that will not have you fall over them. Secure loose rugs with double safe tape or slip-resistant backing. Store clothing, dishes, and food within easy reach. So if you have cupboards that are really tall and you have to get your glasses or your cups or your plates, put everything on the lowest level. Store everything else above you that you don't use on a daily basis. You have to sort of really think to make yourself more safe. Use non-slip mats in bathtub or shower. Keep your home brightly lit. Place a night light in bedroom and bathroom. Place lamp within reach of your bed. Make clear path to light switches. Turn on lights when going up or down the stairs. Store flashlights in easy-to-find places. And I have some examples of this too that I'll be able to show. Use of assistive devices. Handrails for both sides of stairways. Some places don't even have any handrails, but it's really suggested that you have, as we age, have handrails on both sides of the stairways. Non-slip treads to bare wood steps. A sturdy plastic seat for shower or tub. Grab bar for the shower or tub. A raised toilet seat if necessary. A handheld shower nozzle for bathing while sitting down. So I think all of these are really good. Handrails both sides, non-slip treads for bare wood, grab bar, a raised toilet seat. We have a handheld shower nozzle for bathing while sitting down, and it's really great. It connects to your shower head, and you just pull the hose down, and you can just shower, rinse off. It's really so nice, and something that we never thought of buying. Excuse me, and I think it did come with the house. I would not be that intuitive. Medical alert system, devices that can detect a fall even if an older adult can't press the button for help. Discuss with your doctor and family if this is something that would be good for you. So a medical alert system, very good, especially if you have that fear of falling or you have fallen, and this way you can get help immediately if you need it. Remember, move more. Programs available to help seniors with fall prevention. See your doctor for an assessment and tell him why you want to see him. Tell him you've had a fall, you weren't hurt, but I'm afraid. Because if you're afraid, you're going to isolate yourself. Local senior centers will have them. Area Agency on Aging. Hospitals or clinics have them. YMCA has them. So you know that if you have this fear of falling, you really need to do something about it. I have a thank you here, but I am not finished because I am going to move over here and hopefully you'll be able to see me. Well, we talked about lighting. This is so great. We bought it whenever I have to go down to our basement to find something. You just light this, it's battery operated, and it's really great. Now, unfortunately, there was no outlet available for me, but both of these are little plug-ins. You plug it into the wall, and it just gives you so much light. And you press this little button, and it's on, and you could keep it on 24/7, or you could keep it on just at night. This one is a little bit bigger, and it is the same type, but it has multicolors in it. And it really brightens, I would say, use this because it really brightens up, let's say, that bathroom when you're walking into the bathroom at night. So these are two things that I recommend. This is a mat that you use that you could put under your carpets, and it really works. You don't slide with that carpet. I'm talking about a little carpet that you might have in your front of your entranceway, and it really works. You put this down under your little throw rug or carpet that you have, and it will absolutely prevent it from sliding. I also have for the bath. A wonderful mat. As soon as you take your bath or shower, well, your shower specifically, you put it on the side of the bathtub and it dries instantly. But look at the back side. This is all, it doesn't slide at all. So if you have a fear of falling in your bathtub, just use this and they work wonderfully. Flashlights. We keep a flashlight, I keep a flashlight in just about every level. So if the lights go out, you have this little flashlight and it works beautifully and you have it available. Instead of thinking, where's my flashlight? This works. Yeah, I could see it. Can you see it? Mm-hmm. Great, great. So keep that flashlight going. Non-skid shoes. These are like little beach shoes, but look, they have this wonderful ribbing on it, so you can't, it will prevent you from sliding, and that's what you want to do, prevent from sliding. And the same thing, a carpet that's already backed, and that will not slide either. And these are great for your bathrooms. So for your bathroom, please try to have a mat, a carpet, a bench, shower hose, as I mentioned, that disconnects and you can just shower your body, hardware floor, no skid little mini carpets, good lighting throughout the home. I showed you the lantern and the flashlight. As I said, we have one of those flashlights on every level of our home. Carpets, no carpet on top of carpets. I know a lot of people, you know, they have wall-to-wall carpeting, but they have two favorite carpets that they took from their other home and they put them on top of the carpet. That is just something it's not safe. Footwear, I already talked about slippers, no flip-flops, things like that. All of these things really prevent an accident from happening. And that's what this was all about, making sure that you are safe and you do not fall. Thank you very much for attending. Are there any questions? Well, thank you again. I will be back in June, and I'm back in June, and I think it's on stress management. So thank you again for listening, and thank you all for coming.